let's not forget that in Botswana, there are high margins of inequality. High margins of inequality. There are people who have, and there are people who have very little, right? There are people who have a lot, and there are people who have absolutely no access. There are people who live in Pakalani, who live in Broadhurst, and then there are people who live Kotenyanating, right? People with limited access, whether it is to resources, whether it is to education, whether it is to transport, whether it is to basic necessities such as food. There are those people. And these are the people who are underserved, marginalized, people who corruption really, really puts them in a very precarious situation. So basically, I think the conversation with Ka and Khosinga Kagai begs for us as a community, right? It begs for us as a community not to allow the same mistakes to happen, right? I think that's the biggest takeaway I can take from that conversation. We cannot allow the same mistakes to repeat themselves in the new administration, right? We have to do our very best to ensure that we help the new administration to be able to preserve this rule of law, to be able to preserve this the reputation that the country has always had. So I think it is very important for us to engage with the issue of corruption. And I think what is unfortunate and something that is now coming up is that, when we talk about corruption, those of us who have access, right? Those of us who can actually speak up, those of us who can actually say something, we need to say something, right? I've often felt like the reason I went to health journalism is because I was scared to speak truth to power, right? I don't want to say otherwise, but I've often felt that one of the reasons I chose health journalism is because for some reason I thought I was avoiding politics. And then years later, I realized, oh no, politics is health, health is politics. They're very intersected. So unfortunately, I find myself talking a lot about politics on this channel because politics affects our health immensely, right? And when we talk about corruption, it comes in various forms, right? There's corruption in healthcare sectors, there's corruption in education sectors, there's corruption police sectors, right? There's corruption coming from multi sectors. It's multi-sectoral. That's the right word. Corruption is multi-sectoral. It doesn't only affect one area, it affects a lot of areas. But the focus for this conversation and for this channel is to look at corruption in the healthcare sector, right? How does corruption affect these reports that we see in the Voice newspaper? I remember a massive story that the Voice newspaper wrote a couple of years back, where there was a shortage of antiretroviral treatment in the Botswana government hospitals. And guess who the shortage affects the most? It's not you and me, right? Because the fact that you're watching me means that you have a sense of access, you have some sense of resources, you have some sense of, you can do something if you potentially are living with a health condition that needs that treatment. If you're watching me on YouTube, it means that you have some means to potentially buy your own antiretroviral, right? That you are not as dependent on the government stock as somebody else who lives in a rural area, right? So this is why I think corruption is most unfortunate, because it affects the people who already have very limited access to resources, right? I often say this, the people, those of us who are on social media, those of us who are on YouTube, those of us who are able to, just be able to be keyboard warriors, if you say, if to put it that way, we really need to do more, right? We really need to do more, because the people who are not engaging with us right now, they need us. They really need us to be able to say something on their behalf, because they are not even being heard. I think the Voice story was very telling, because the stock out, the antiretroviral medications that were running out um, had been going on for a while. But because it was affecting people who have limited voices, it went on for so long. And we can only imagine the consequences of someone who's living with HIV, who doesn't have access to these antiretrovirals. What does that mean for their U equals U status? Do you understand what I mean? Like, what does that do? It compromises their health, right? It compromises their health, and that is why I think it's so important to highlight this link between corruption and healthcare, and to also encourage you, those of us who have access, those of us who have means, to do something.